J. Marion Sims's gynecological experiments. In the 1840s, an Alabama physician, later nicknamed the father of modern gynecology, set out to develop a surgical repair for a serious and common childbirth injury called vesicovaginal fistula, a condition that caused constant, debilitating incontinence and left affected women socially isolated. Working in a small hospital he built on his own property, Sims performed repeated experimental surgeries on enslaved black women, most notably 3 whose first names survive in the historical record: Anarcha, Lucy, and Betsy, without their consent and in most cases without anesthesia, even during the later years of this work when ether had already become available and was in use elsewhere for surgical procedures. Anarcha alone reportedly underwent around 30 separate operations before Sims finally perfected his technique. He justified withholding anesthesia using the era's widely accepted but scientifically baseless belief that black patients experienced less pain than white patients, a claim that had no basis in physiology and was used across multiple areas of medicine at the time to rationalize similarly abusive treatment. Sims went on to found the Woman's Hospital in New York and became one of the most celebrated surgeons of his era, with statues erected in his honor in multiple American cities. It wasn't until a sustained public reckoning beginning around 2017 that several of those statues were formally removed, including one that had stood in New York City's Central Park for over a century. Nazi human experimentation. Between the 1930s and 1945, physicians working within the Nazi concentration camp system conducted a wide range of experiments on prisoners without consent, frequently resulting in death, permanent disability, or severe and lasting suffering. These included studies on human survival in extreme cold, in which prisoners were submerged in ice water or left outside in freezing temperatures to measure how long the body could survive and what methods might best revive someone afterward. High-altitude and low-pressure experiments simulating conditions faced by pilots at extreme elevation, and deliberate infection with diseases including malaria and typhus to test experimental treatments and vaccines. Perhaps most infamous were the twin studies conducted under Josef Mengele at Auschwitz, in which identical and fraternal twins were subjected to comparative medical procedures, injections, and in some documented cases, deliberately induced illness or injury in an attempt to study heredity and genetics. After the war, 23 defendants, the majority of them physicians, were prosecuted in what became known as the Doctors' Trial, the first of the subsequent Nuremberg proceedings following the main International Military Tribunal. The judge's final ruling in that case included a 10-point set of ethical principles for human research, now known as the Nuremberg Code, which became the first major international document to formally require voluntary, informed consent as a precondition for any human experimentation, a principle that had never before existed as binding medical or legal doctrine anywhere in the world. Unit 731, operating from 1935 to 1945, this was a secret Japanese Imperial Army research unit based in occupied China, dedicated to developing biological and chemical weapons through direct experimentation on prisoners, referred to internally as Maruta, or logs. Its purpose was twofold: advancing Japan's biological warfare program and studying how the human body responded to disease and extreme conditions. The method followed a consistent research procedure. Prisoners were deliberately infected with pathogens including bubonic plague, cholera, and typhus, then monitored and periodically operated on without anesthesia so researchers could observe disease progression directly inside a living body. A separate frostbite research program submerged prisoners' limbs in ice water until frozen solid, then tested different rewarming methods to determine which best preserved the tissue. Estimates of the total killed range from several thousand into the tens of thousands. In one of the most ethically troubling decisions of the post-war period, the United States secretly granted the unit's leadership full immunity from war crimes prosecution in exchange for exclusive access to its research data, meaning the individuals most responsible were never tried at the Tokyo War Crimes Tribunal that prosecuted other Japanese wartime atrocities, and the immunity arrangement remained classified for decades afterward. Tuskegee syphilis study. Beginning in 1932, the United States Public Health Service enrolled 600 black men from Macon County, Alabama, in a long-term study of untreated syphilis, recruiting participants with the promise of free medical care, meals, and burial insurance, while telling them only that they were being treated for an ailment locally referred to as bad blood, a vague term that didn't disclose their actual diagnosis. Roughly 400 of the men in the study actually had syphilis and were never informed of their real condition, let alone offered treatment for it, even after penicillin became a widely available and highly effective cure for the disease by around 1945. Researchers actively worked to prevent participants from receiving treatment through other channels, including intervening when local draft boards identified infected men for military service, since the Army would have treated them. The study continued uninterrupted for 40 years, ending only in 1972 after a public health service employee turned whistleblower brought the study's existence to a national newspaper. By the time it ended, dozens of the men had died directly from syphilis or its complications, and the disease had been transmitted to some of their wives and congenitally to some of their children. President Bill Clinton issued a formal, televised apology to the study's few surviving participants in 1997, a full 25 years after the study itself had finally ended. Guatemala syphilis experiments. In a project that remained entirely hidden from public knowledge until a historian uncovered it by accident in archived personal papers in 2005, the same U.S. Public Health Service ran a considerably more aggressive and invasive experiment overseas just over a decade before Tuskegee ended. Between 1946 and 1948, researchers deliberately infected more than 1,300 Guatemalans, prisoners, soldiers, and patients confined in a psychiatric hospital, with syphilis, gonorrhea, and chancroid without their consent or knowledge, specifically to test whether penicillin could prevent infection when administered shortly after exposure, rather than simply cure the disease once symptoms appeared. When natural transmission through arranged contact with infected sex workers proved too unreliable for the researchers' purposes, investigators began directly inoculating subjects with the bacteria instead. At least 83 deaths were formally recorded among those exposed, and one psychiatric patient, already gravely ill from the deliberately induced infection, was documented as having been infected again by researchers shortly before she died. The U.S. government did not formally acknowledge or apologize for this program until 2010, more than 60 years after the experiments had concluded, following renewed public attention driven directly by the historian's discovery. Cold War human radiation experiments. Between the 1940s and 1970s, researchers funded by U.S. government agencies conducted numerous studies involving direct human exposure to radioactive materials, frequently without the knowledge or informed consent of the people involved. Perhaps most disturbing among these was the direct injection of hospital patients with plutonium conducted to study how the human body absorbed, distributed, and eliminated the material, critical data for the developing nuclear weapons program, but data obtained from patients who in many cases believed they were receiving ordinary medical treatment for unrelated conditions. One of the earliest documented subjects, a construction worker injected with plutonium in 1945 after being hospitalized for a car accident, was never told what had actually been done to him. A federal advisory committee on human radiation experiments was eventually convened in the 1990s to formally investigate the full scope of this history across dozens of separate research programs, and President Bill Clinton issued a formal public apology in 1995 once the committee's full findings were released. Fernald School Radioactive Oatmeal Experiments. Between 1946 and 1956, researchers from Harvard and MIT, with partial funding from the Quaker Oats Company and the U.S. Atomic Energy Commission, fed radioactive iron and calcium tracers to boys living at the Fernald State School, a Massachusetts institution for children with intellectual disabilities, in order to study how the body absorbed minerals from food. Rather than seeking meaningful consent, researchers recruited boys through an invented science club, offering incentives that were genuinely significant to children living in an institution known for harsh, deprived conditions, extra servings of food, gifts including Mickey Mouse watches, and trips to Boston Red Sox games. Parents who were asked to sign consent forms were never told that radioactive material was actually involved in the study their children were joining. The research wasn't secret in the sense of being hidden from the scientific community. Results were published in academic journals at the time, but it remained essentially unknown to the public and to the affected families themselves for nearly 50 years. surfacing only after a 1993 government review of Cold War-era radiation research. MIT and Quaker Oats ultimately settled a class action lawsuit brought by former Fernald residents for $1.85 million in 1998. Willowbrook Hepatitis Study. Between 1956 and 1972, researchers at the Willowbrook State School, a severely overcrowded New York institution for children with intellectual disabilities, deliberately infected newly admitted children with hepatitis in order to study the disease's natural progression and test early experimental vaccines. The infection itself was administered either by injection or, in many cases, by feeding children a milkshake mixed with stool extract taken from other children already infected with the virus, a deliberately oral route of infection since researchers were specifically trying to model how hepatitis spread naturally among residents through the institution's unsanitary conditions. Consent from parents was obtained under conditions researchers themselves acknowledged were coercive. Willowbrook had a long waiting list for admission, and in at least some documented instances, parents were told or given the strong impression that enrolling their child in the hepatitis study was the fastest, or in practice the only realistic, path to securing a bed at the facility at all. Researchers defended the study at the time by arguing that residents were likely to contract hepatitis regardless, given the institution's severely unsanitary living conditions, an argument that later bioethical analysis has widely rejected as a rationalization rather than a legitimate ethical justification, since creating and tolerating those same unsanitary conditions was itself part of what made the argument possible. The study's lead researcher was, remarkably, elected president of a major national pediatric medical society the same year the study ended, and later received several of medicine's most prestigious professional honors. Holmesburg prison experiments. From 1951 to 1974, a University of Pennsylvania dermatologist ran an extensive, long-running research program on inmates at Holmesburg Prison in Philadelphia, testing cosmetics, pharmaceutical compounds, and hazardous chemical agents including dioxin directly on prisoners' skin, paying participants small sums of money, often just a few dollars per test, for their involvement. The researcher later described his first impression of the facility's population, upon seeing hundreds of inmates for the first time, as seeing acres of skin available for testing, a remark that became the title of the definitive book later written about the program. Participants were disproportionately poor and Black, drawn from a literally captive population whose ability to give truly voluntary, pressure-free consent while incarcerated has been widely questioned by bioethicists in the decades since. The full scale and nature of the program only became broadly known to the public decades later, primarily through investigative research published in the 1990s, and the University of Pennsylvania issued a formal public apology in 2021. Nearly half a century after the last experiments at the prison had taken place. The Jewish Chronic Disease Hospital Cancer Study. In the summer of 1963, cancer researcher Chester Southam arranged to inject live, cultured cancer cells directly into 22 elderly, chronically ill patients at a hospital in Brooklyn, New York, as part of a study examining whether a weakened immune system alone, separate from having cancer itself, affected the body's ability to reject foreign cells. Patients were not informed that the substance being injected contained cancer cells. They were told only that they were receiving a routine skin test. Several physicians on staff refused Southam's request to participate and were troubled enough by what they'd been asked to do that 3 of them formally complained to state medical authorities, with one hospital board member publicly comparing the experiment's ethics to those of the Nazi physicians tried at Nuremberg less than 2 decades earlier. New York's Attorney General ultimately argued that every patient possessed an inalienable right to know and decide what was done to their own body, and the state's Board of Regents found Southam guilty of fraud, deceit, and unprofessional conduct, suspending his medical license for 1 year. Despite this formal finding, Southam went on to be elected president of the American Association for Cancer Research just 2 years later. Stateville Penitentiary Malaria Study. Beginning in 1944 and continuing in various forms into the 1970s, researchers from the University of Chicago, working with funding and support from the U.S. Army, deliberately infected inmates at Stateville Penitentiary in Illinois with malaria in order to test the safety and effectiveness of newly developed anti-malarial drugs needed to protect American troops fighting in malaria-endemic regions overseas. Infection was induced through the bites of malaria-carrying mosquitoes bred specifically for the study and allowed to feed directly on volunteers' skin, after which subjects were monitored through the resulting fever cycles and given experimental drug regimens to test both effectiveness and side effects. Participation was incentivized through offers of significantly shortened sentences and modest cash payments, a structure many bioethicists now consider inherently coercive given the severe power imbalance between incarcerated men and the institution controlling their freedom. Some of the experimental drugs tested caused genuinely severe side effects in participants. A 2025 historical study published in JAMA uncovered a previously overlooked chapter of this history. Starting around 1950, Black inmates, who had largely been excluded from the earlier phases of the research, were specifically brought into a later stage of the study, deliberately infected with malaria, and given high doses of the drug primaquine because researchers already suspected correctly that the drug caused a dangerous reaction in some Black patients and wanted to understand why. Research that eventually contributed to the modern understanding of a genetic enzyme deficiency now screened for before prescribing certain medications. The Aversion Project. Operating within the South African Defense Force from roughly 1969 to 1987, during the apartheid era, this secretive military psychiatric program, led by psychiatrist Aubrey Levin, targeted conscripted soldiers identified as homosexual for forced curative treatment, since the military at the time classified homosexuality as both a mental illness and a threat to unit cohesion and national security. Conscripts identified as gay, often through intrusive screening at the point of enlistment, were sent to a specific psychiatric ward and subjected to techniques including electric shock aversion therapy, in which soldiers were shown same-sex imagery while receiving painful electric shocks intended to build a negative association, alongside chemical castration using hormonal agents. When these methods failed to alter a conscript's sexual orientation, as they invariably did given that no legitimate scientific basis for such conversion ever existed, some individuals were subjected to non-consensual or coerced sex reassignment surgery instead, procedures from which many were left with lasting physical harm. An estimated 900 men and women were subjected to some form of this program over its nearly two-decade run. The South African Medical Association issued a formal public apology for the program in 1995, though no doctor directly involved, including Levin himself, faced criminal prosecution or lost their medical license as a direct result. Project 4.1. On March 1st, 1954, the United States detonated Castle Bravo, its largest ever thermonuclear weapons test, at Bikini Atoll in the Marshall Islands, a device roughly 1,000 times more powerful than the Hiroshima bomb. The test produced a far larger radioactive fallout plume than scientists had predicted, blanketing the nearby inhabited Rongelap Atoll in radioactive ash that children reportedly played in, mistaking it for snow. U.S. officials waited 3 full days before evacuating the affected population, despite being aware of the radiation risk far sooner. In the immediate aftermath, the U.S. government quietly launched Project 4.1, a formal medical study of the exposed Marshallese population's response to radiation, providing valuable human data the U.S. could not have ethically obtained through deliberate testing. Rongelap's residents were allowed to return to their home island in 1957, with officials publicly declaring it safe, even as internal government records from the time reveal officials privately describing the island as among the most radioactively contaminated places on Earth and recommending continued study of the population living there. Subsequent long-term research confirmed significantly elevated rates of thyroid cancer and leukemia among the Marshallese populations most heavily exposed, effects that continued to affect the community for decades afterward. MKUltra. Running from 1953 to 1973, this CIA program tested LSD, hypnosis, sensory deprivation, and a range of coercive psychological manipulation techniques on both willing volunteers and, in a significant number of documented cases, entirely unwitting subjects, in a search for reliable methods of mind control and enhanced interrogation during the early Cold War. One especially notorious sub-project, codenamed Operation Midnight Climax, used sex workers as unknowing intermediaries, paying them to bring clients back to CIA-run safe houses where the clients would unknowingly be dosed with LSD, while agents observed and recorded the encounters from behind one-way mirrors. In 1973, amid a growing federal investigation into CIA abuses, the agency's director personally ordered the destruction of the vast majority of MKUltra's records. Much of what's known about the program's true scope today survives only because of a later Senate investigation, and a separate cache of roughly 20,000 financial and administrative documents that had been mistakenly stored in the wrong records facility and therefore escaped the 1973 destruction order. Taken together, these 15 cases share a common thread that runs across nearly a century and multiple continents. Vulnerable, frequently already marginalized populations, the incarcerated, the institutionalized, the colonized, the enslaved, and the poor, subjected to experimentation without genuine informed consent, almost always justified at the time as necessary for scientific advancement or national security. The consequences of that pattern being repeatedly exposed decade after decade eventually reshaped the entire framework of medical research. The 1947 Nuremberg Code was the first major international statement that voluntary, informed consent must precede any human research. The 1964 Declaration of Helsinki followed, establishing international ethical guidelines specifically for physicians conducting clinical research. And in direct response to the public exposure of the Tuskegee study, the 1979 Belmont Report established the three core ethical principles: respect for persons, beneficence, and justice, that still formally govern human research conducted in the United States today. Every human study now carried out in the country must pass review by an institutional review board before it can begin, a direct, permanent institutional legacy of exactly the history covered in this video.